So, welcome everybody. I am so excited to have this. I used to do lots and lots of lives, especially during COVID, and I stopped, and it took me a little while to get my momentum back, but I'm back and it is going to be coming. There are so many questions that I field every day, and I realize that there is a gap in access to good, credible, resourceful information. So, before I get started, I want to say thank you so much for giving your time and your attention to this. And when you leave here, you're going to leave here with things that are going to help you improve your balance and hopefully decrease your risks of falls. So we're moving to the next slide, if it will participate for me. There we go. So September is Fall Prevention Month internationally. September 8th was World Physiotherapy Day. I am a physical therapist. I am very passionate about being a physical therapist. I've been a physical therapist for 25 years. So I'm a full-grown adult. I'm still learning, but I love what I do. I'm still in the profession 25 years later, and I have a commitment to the health improvement of the Bahamas. We have a beautiful country. We need to keep ourselves healthy so we can enjoy it. We have visitors that come in every year and they enjoy the Bahamas and they swim and they ski and they boat. And a lot of us are in the country and we do not even take a walk on the beach. So we really want to change the culture of physical activity and movement in the Bahamas. And that's one of my passions. So we're talking about fall prevention. And there's so many different components of fall prevention right now that we could be here for hours, like I said. But what we're going to talk about today specifically is for balance. We're talking about balance. And why does balance matter? Balance matters because falls are the leading cause of injury in adults in the Bahamas. And most people think of falling as just a part of aging, but it's not. Like you think, oh, I get old, I'm going to trip down, but it's not. It's so much more than that. And there's so many younger people falling, right? And so when we talk about injuries, as I said, as a physical therapist, I'm seeing fractured wrists, fractured rib cages, fractured hips, sprained ankles, fractured leg bones. And when I say leg bones, I'm talking about the tibia and fibula, so your little ankle bones. There's so many of these injuries. That's just the fractures. That's not the soft tissue sprains, strains, and contusions that we see. And we know that injuries create a greater challenge for people. So what we want to do, what I want to do as a physical therapist is stop that. We want to put a hold on those things, make people more aware of how they can improve their balance so they'll fall less. And yes, it's the leading cause of injury in adults in the Bahamas, but 1 in 4 adults worldwide over the age of 65 fall each year. The number one cause of injury related to hospital related injuries worldwide. And like I said, there are many reasons for falls. So it could be poor ergonomics in your home. You have a lot of throw rugs, you have a lot of cords, you have heavy furniture, you have that beautiful pet that keeps running underneath your feet. You don't clean up after yourself, or somebody makes a spill. All of these things could be slips, reasons for you to have slips and falls. But we're going to bring it right back to you individually, what you could control, and that is your balance. We know that when people have poor balance, they don't want to move as much. And because they don't move, their health gets worse. And then the quality of life gets worse. Remember what I talked about? It's about improving our quality of life. And we'll talk more about that as we go on. So, what exactly is balance? Balance is, believe it or not, a sense that we have. We talk about taste, touch, smell, and all of these things, but balance is also a sense. It's a function of the human body, and we take it for granted. We take it for granted it's 206 bones to stand up and stay upright in the air for most of the time and move through space. That takes balance. That takes muscles, that takes ligaments, soft tissue, everything to hold up, and we just do not pay attention to it. But to stay balanced, you need to know where you are. So that's why vision is important. This is why you need to make sure that you have your eyes examined every year. And especially as we get older, we do have changes in our vision, right? Our lenses become less reactive, they become more stiff. And so depth perception, how far something is up and down or away, is an issue. What we call peripheral vision becomes an issue. I only can see so far instead of all the way I used to see when I was much younger. So there is an aging component to it, but it doesn't have to be as severe as it is in some people. The other sense or component of balance is what we call inner air balance. For people who may experience vertigo, that's one of the dysfunctions of the inner air system. Or you remember when we were kids and we would just spin and spin and you spin and you stop moving and your head keeps spinning? It's because those little stones in your inner air are now all disoriented and they don't know where you are in space anymore. There are some people who end up with different diseases that affect those little stones, those little lits, and can cause vestibular issues. Then there's body awareness, and body awareness is proprioception, what we call knowing where you are in space. So sometimes when there's a neurological injury, like a stroke or a bad injury to a muscle, a nerve that serves the body part, people don't can't recognize, the brain doesn't recognize where the body is in space. We see it more when people are walking and they step and they think their leg is higher than it is and it's not, and it hits the step and they trip. They think they're stepping over the curb. They in their mind the leg is this high, but it's this, and in fact it's only 2 inches instead of being the 4 inches should be. And that's one of the things that can affect your balance. Muscle strength. If you do not have the strength to move, you can't balance because you need your muscles to react. If I'm falling forward, I need my muscles in my back line to pull me back. If I'm falling back, I need my abs to pull me forward so I don't fall. If I'm going down, I need to be able to reach out my hand and brace or hold on. So muscle strength is extremely important. And I've talked on more than one occasion about the brain so far. If the brain has any challenges, and that can be things like Parkinson's disease. It can be like ataxia, where the movement is not where it's supposed to be. Those things can impact your balance as well. So you can see balance is quite complex. It's not just this or it's that. There are many different factors that come together, and this is why there's a whole movement or a whole scope of physical therapy that's called vestibular therapy or balance therapy, that goes very much in depth to deal with these issues that can present in a lot of our population. So I wanted to make this as interactive as possible, right? And so what I want you to do is I want you to stand up where you are. Your cameras are off. I can't see you, so you have to be honest. I want you to stand up where you are, and just like this figure in the picture, hold one of your legs up and let's count for the count of 10 seconds. So I'm going to give you a chance to stand up, stand next to a counter or a chair, and see if you can hold on, if you can hold your leg up for 10 seconds. Okay? So we're going to go. Jackie's leading, so I'm going to go on her count. Raise your leg. Thank you. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and bring it down. Good. Did anybody wobble? Did anybody fall? And I want this to be as interactive as possible. It's a
I
small group.
wobbled towards the middle of it.
Okay, but you were
Now
able to
let's see
regain
on
your
this left
balance?
leg though. I
But you
don't
were
know
able
about
to
the left.
regain your balance because you didn't fall.
Yeah, I
Okay.
didn't.
All right. So now let's switch to the opposite leg now. So we're going to stand on that leg. Ready? Let's go. Hold that leg up. 10, 9, 8,
I
7,
can't do this.
6, 5, 4, 3, 2, 1.
Yeah,
Fantastic.
yeah.
Now, I know she doesn't mind me sharing this information. Jackie happens to be my cousin. I'm very proud of her. We support each other a lot. And in this vein, I'm going to say that Jackie's very strong. Jackie owns gyms and she just released a fitness app. So this woman works out. But if you notice, Jackie had an issue with her balance. And
Yeah.
because I know her history, she had a really bad sprain. I think twice she sprained that same ankle, right? And so,
Right.
because she has the muscle strength, she still has probably proprioception challenges in the joint and maybe even some tendon issues in the joint. And that affects her strength and stability in that joint. Now, Jackie could probably do 100 burpees and do whatever she needs to do and leave us in the ground. But when we break balance down into those fine components, we're able to find the dysfunction. And my job as a physical therapist is to pinpoint those dysfunctions and correct them so they don't manifest as an injury or a dysfunction in how you move. So I hope you didn't mind me sharing so much, Jackie, but you were like the perfect example for this. So this is a woman that exercises practically every day. Like you could go on her page and she's exercising, right? She does it live sometimes. When we spend time together, she's grabbing the dumbbells and she's going. She's always exercising. Imagine the person that is not as active as she is. Imagine the person is not exercising at all, how their deficits and dysfunctions may show up. Okay. So here's another one. This is sit to stand. What we're going to do is we're going to sit to stand 5 times. All right. So you're going to stand up, your feet are shoulder width apart, hold your hands out in front of you, and you're going to sit and then stand up 5 times. We stop after your butt hits the chair the fifth time. Ready? Go. One, and up, two and up, three and up, four and up, five and up, and six. Good job. All right. Now, nobody else is talking to me, so I don't know how you guys are coping with these exercises. But tell me, was it easy? Was it medium? Was it hard? And it's not just about the balance aspect of it. It's just, did you have the strength to get in and out of the chair? Because remember, we talked about how strength is a big component of it, right? And that is something that's very, very important. Strength. This is a good indicator of how strong your lower extremities are. They are the two pillars that you're going to stand on. Your feet are your foundation and your legs are the pillar. So I just checked the chat and Jackie asked a question about if high blood pressure could affect it. So yes, on multiple levels. I'll talk about it a little later, but let's talk about it right now. You see this movement here where we go from sit to stand? This is a change in position. Your ears can be affected, but also your blood pressure can be affected because all of a sudden you're going to stand, so you're going to have a rush of blood towards your feet. There is a condition called orthostatic hypotension, meaning that when you stand, your blood pressure drops. That can cause dizziness. We talked about the brain. That dizziness can impact your balance. So, yes, for this right now, hypertension or hypotension changes, rapid changes in blood pressure, or elevated at the range and lower at the range can affect your balance. So good question. Thank you so much. And then the last one is functional reach. Okay, my other guy didn't reach here. But with the functional reach, this person's standing up. You can do this in sitting down. So I'm a very inclusive physical therapist. Everything that I've shown you so far is somebody who's able-bodied who can actually stand up. There are some people who can't stand, whether they're paraplegic, whether they have an amputation, whether they have severe injuries and they're unable to stand or their balance is so poor. So we have a test that we do called the functional reach test. And you see here it says sit or stand. So what that would look like is, hopefully you can see me. Let me come a little closer. Your arms are outstretched. And what you do is you reach as forward as far as you can without tumbling over or losing your balance. And what I would do is measure how far the distance is from where your fingertips start to where the functional reach ends. And there are different charts that we use to rate you according to your age to see the distance that you can extend and maintain your balance. So this is a great tool for people who cannot stand. All right. Believe it or not, some people sitting in the chair that can walk can't do this because their abdominal strength is so weak and their back strength is so weak. Or they may have severe back pain or severe back spasms and their muscles don't respond the way they need to do. And this is how a lot of people fall because if you're falling forward, you have to be able to catch yourself and bring yourself back. With the reverse, if you're falling back, you need to catch yourself and bring yourself forward. So that's so, so important. So let's talk about what puts someone at fall risk, right? Do you feel unsteady when you're walking? Have you had any recent falls or any near falls? And that's within the last 12 months. So we get really excited when somebody's fallen in the 12 months. It's not excited you fall, but excited the fact that we need to try and figure out why did you fall and why and how can we fix the issue. Okay, so thank you so much for the responses so far. We have knees and back hurting, and then we have medium. I felt it in my knees, so we need to do some knee loving exercises. Okay, ladies, I got you. I got you. Now, the other thing we have to talk about is what we call polypharmacy. If you take four medications or more, this is what the literature says, but I say if you take one medication, that could impact your balance, impact your awareness. That is a risk for falls. Now, we have some people that are hypertensive, diabetic, high cholesterol, anxiety. So they have what we call a cornucopia of medication. Those things could interact and play with your blood pressure, play with your awareness, play with your function. And when I say play, you know what I mean. It affects those things. And so we want to make sure that if you're taking those medications, that they're not going to become complex. Yes, they're going to become complex and create more issues for you. Okay? All right. So we have somebody that's fallen in the last 4 months. We need to figure out why you fell. And I'm not sure if HRT medication may impact it. I'll have to do a little bit more research on what actual medication it is. But here's the other thing. Remember that we are so intricately and individually made. Whenever you pick up a medication box, they always tell you there is a 1 point something, 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 something chance that you may have an adverse reaction. You just might be that 1 point something, 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 something person. So always leave room for that. And this is why a lot of people now are leaning away from pharmaceuticals and more towards natural medicines, herbal medicines that seem to have less impact on the overall physical structure of the body. All right. It's more tonic, it's less aggressive because medications usually give you a very exacerbated effect on whatever it's trying to do because it's trying to fix the problem quickly. But if you take herbs and you eat the right foods, you have what we call a tonic buildup of healing and wellness. So that's just the point I'm going to throw in there. Okay, so here we go. Next. So I mentioned before, balance is not an age thing. We just talked about if you have high blood pressure, if you have um, uh, high blood pressure, if you have issues with your inner air, here's something else that we have issues with, and we'll talk about it. Non-communicable diseases. They usually show up in our population: diabetes, hypertension, arthritis, cancer. There are quite a few more. Any cardiovascular disease, right? These are what we call non-communicable diseases. Usually, these diseases are lifestyle diseases, meaning that our behaviors and habits can control or reverse these diseases and their presentations in their body. So, this is why we're so excited about using physical activity as a modality to help. The World Health Organization promotes that we need to have 150 minutes of exercise per week. That's not a lot. That's 30 minutes per day, 5 days a week. And I'll be the first to say sometimes I struggle to remember to do my 30 minutes in because my job is so physical and I'm moving. I think that's physical activity, or I used to think that's physical activity. It is physical activity. But what we want now is more designed exercise, things that I want to target. So I'm over 50 now, so I need to make sure that I'm strengthening my muscles. I want to make sure that I'm doing impact exercises so I can keep my bones strong because as women, as we go through menopause and we lose our estrogen, we have bone weaknesses, right? Our muscles aren't as strong. So if I know that's going to be a natural course of aging, I need to fight it on the other side and make sure that aging has a lot to work against. So I'm going to stay as strong as possible. And this is why we need to do our exercises, everybody, but specifically women. Okay. So let's talk a little bit more about diabetes. Diabetes, people living with diabetes has a higher risk fall, and here's why. They have issues with controlling blood sugar levels. So they have so much sugar in their blood system, their body is not dealing with it the way it's supposed to. It starts to get deposited in certain structures. And the most vulnerable structures are the smallest blood vessels. So this is why we usually have issues with the eye. The smallest blood vessels are also in the kidney, and the smallest blood vessels are also in the sexual organ area. So men show up with erectile dysfunction. Women can show up with numbness and tingling in those areas, and also the blood vessels that serve the nerves and the nerves themselves get impacted. So they end up with what we call neuropathy. The nerves are damaged because the blood going to the nerves is being impeded because of the deposit of the extra glucose, as well as it affecting the nerves themselves. So they end up with numbness and tingling. And we call that the stocking and glove syndrome. Because you can have neuropathy from a nerve injury in the neck where you have numbness and tingling in one arm if you have a bulging disc. But with diabetes, because it affects the entire body, you have what we call a systemic approach. So the cardinal sign to know that your neuropathy is from diabetes is that both hands are numb, both feet are numb, or both legs are numb. Now, it can be hands by themselves or feet by themselves, but usually they come as a pigeon pair, a pair as a duo shows up, both show up. Those people are higher risk at falls because of the neuropathy, the numbness in the feet. They can't feel where they're stepping. Their proprioception is affected as well because they don't know exactly where those joints are. And so people who have diabetes that's uncontrolled and untreated can have serious issues with their balance. And I want to go back to neuropathy. I didn't list it here, but there are certain chemotherapy drugs, especially the ones that are called taxanes, that also damage the nerves. They also leave people with neuropathy, that numbness and tingling. So I treat a lot of cancer patients. My specialty is breast cancer rehab and cancer rehab. So one of the things we check is to see what the sensation is like on the feet and how the joints are behaving, because we know that the risk for fall goes up once they've had chemotherapy treatment with the taxane drugs. Another thing that causes balance issues is swelling in the legs. So people who have uncontrolled circulation, they have lymphedema or they have lipedema, the legs get heavy. So just imagine, you're supposed to be nice and slim, and then you end up with a foot in a water balloon. You don't know where your foot is in space. You don't know when you really hit the bottom. There's extra fluid, so your joints are more unstable. And this is why people who have very swollen legs may have serious issues with balance. And if you have poor balance, you don't want to move. Arthritis. If my joints are achy and painful, I don't want to move. If I've lost my peripheral vision and I keep bumping into things, I don't want to move. If I have medication that drops my blood sugar levels or drops my blood pressure levels, I don't want to move. I don't feel safe. These are all hidden risks, and this is why we want to be so intentional with making sure we control our blood sugar levels, controlling our blood pressure levels, and we do as much as we can to stay active. But we're here talking about falls being preventable. So what could we do? I talked about ergonomics in the home and the work. Take away the throw rugs, the drop cords. Try and keep your space as safe and as free as possible. Does that mean adding grab bars in the bathroom? Does that mean changing the counter heights and the cupboard so you don't have to overreach and lean back? You want to make sure that your environment is as safe as possible and you remove as much risks and hazards as possible. The other thing is what I talked about before, move. You guys just did a whole exercise routine and didn't even think about it, right? So if you had to stand in place and just march, instead of holding it for 10 seconds, you just march for 5 minutes. Just like that, you could hold onto the counter and just lift one leg at a time. That's exercise. It's physical activity. Sit to stand, in and out of the chair. That's squatting. And you can do that every 2 minutes and change it up until you get 30 minutes. You can reach forward and pull back. That's an exercise routine. So these are things that you can do to stay active, to stay fit, and to move. The other thing is making sure that you stay in touch with your medical professional, your medical doctor, because you want to make sure that we know what the numbers are. We want to know what your blood pressure is. We want to know what your blood glucose levels are. We want to know how your eyes are performing. Are you hearing? Because if you can't hear, then you can't look out for any hazards or risks that are nearby. And you want to make sure that your medication is being checked properly and regularly. And when I say check, I mean this. If you take your medication and you feel that you're dizzy, every time you take your medication, that may not be the best medication for you. But we cannot have well-informed conversations with our physicians about our medication if we're not taking good notes. So, what I want you to do is that if you're on medication, write your medication down, write the time you take your medication, and write the symptoms that you feel when you take your medication. Now, everything you experience is not due to your medication alone. Are you eating on time? Are you eating your 3 meals or 2 meals a day, however you've decided to eat? Are you sleeping? Are you getting 6 to 8 hours of sleep? Because if you're tired, you're more at risk for falling. The more aware you are, the safer you are. So you need to make sure that you're resting properly, you're adequately hydrated, because if you're dehydrated, that's going to also be another risk for falling, right? Your joints and your muscles are stiff. You're less aware because you just don't feel very well. So all of these things have to be recorded. And you can record it over a period of a week or 2 weeks. So when you go to your medical doctor and he says, well, so how are you doing today? Doc, every time I take this medication, this seems to happen. And I've tried it when I take it with food, when I don't take it with food. I ate well that day, I slept well that day, and I still have these symptoms. You have to become your own health advocate. Gone are the days when the doctor gives us medication and we just swallow it without giving them the response or responding and having engaging conversations. You're paying them. You need to get value for your money and have good conversations with them so that we can make intelligent, well-informed decisions on how your health is going to proceed and your treatment's going to proceed. All right, quick home fixes. These are other exercises you can add. Heel raises. Find a little block or a step, something, and hold onto the wall. And then you go up and down on your toes. 10 reps. 10 reps today. Add another 5 in 2 days. Add another 5 in 3 days. By the end of the third week, you should be able to do 50 toe ups. This is so good because what the toe up is going to do is strengthen your calves, strengthen your glutes. Your quads in the front also get a good stretch, but it also can be a good ab workout if you keep your tummy tight whilst you do it, right? So that's an easy peasy exercise for you to add to your routine. Then we have tandem standing, and tandem means you're just standing with one foot in front of the other, just like this. And you can hold onto your countertop, you can hold onto the wall until you feel more balanced and then just let go. And what you want to do is you're trying to wake up your core and your postural muscles, remind them of where they should be in space and how hard they should be working. Excellent, easy exercises anyone can do once you're able to stand up, of course. We have exercises for people who are unable to stand, but since everybody is standing tonight, we're going to work with that. So, what's next? You've heard what I've talked about. You're like, okay, I don't feel as balanced. What could I do? We have balance screenings, which are really, really good for picking out the dysfunctions that we talked about earlier. I actually have one scheduled in Exuma on the 19th, Ms. Nair. That's why I asked you which island you were on, because I also work in Exuma. And so we have one on the 19th that's scheduled for 10 a.m. It's going to be at the government clinic. And we're going to do a lot more education about balance, and we're going to do the screening. What we also do is teach you 10 corrective drills at your level. I just gave you 5 corrective drills, believe it or not. So you got half of it already, right? We talk about more about how balance connects to chronic conditions like diabetes, swelling, arthritis, and give you exercises and tips to how to counteract those things and prevent them from impacting your diabetes, your balance. The other thing is we help you to build your own daily balance plan. And some of that is what I talked about already. making sure you write down how your medications affect you, making sure you write down what you eat on a daily basis, how you sleep on a daily basis, ensuring that you try and get a minimum of 30 minutes of exercise every day. Because remember, we want to stay as strong as possible. So, thank you so much for your attention. That was a quick and dirty. I promise not to stay long. I kept it into half an hour. So I'm glad to see Ms. Bow is still with us. So hopefully, if you have any questions, I'll be happy to answer those questions for you now. Any questions?
Good night.
Good night.
No question, but I stumbled across the program, right? And the first thing you touched was fractured wrist. And that's what happened to me on Sunday.
Oh,
I I was walking, going down some steps, and because I can't even say how I felt. I can't
right.
tell what happened. All I know, I felt like I was falling and I was actually falling.
Okay.
That's how I received a fractured wrist. But I just want to say that the information was very informative for me because I am on blood pressure medication.
Uh-huh.
And so just to hear what you're saying, it just a light bulb went on my head. So remember when I first started, I say information, knowledge is power. And so I want to say thank you for all the knowledge that you've given me tonight. I took my notes, and so I'm going to start my I'm going to follow through on some of the tips that you gave me. So I want to say thank you.
My pleasure. You could take my number down. We could WhatsApp me, and then I could send you um an exercise program that I've done to meet for this. So,
Okay.
yeah, so you can get some of that. And then, I could ask you a few more questions about how your wrist is healing and how you're doing with that.
Yes, ma'am.
All right.
Okay. Will do. Thank you.
My pleasure. My pleasure. Mrs. Bow, any questions?
Um, Not really. I've been working on exercises and then some others, so I was able to stand on those two examples. I wanted to know on the Friday because I was going to ask my husband if he could check that out.
Uh-huh.
It's well, do you know how long you will be there for that? Is it like a duration like 10 to 12 or something like
Yeah,
that?
we're looking at, I'm trying to keep the presentation to about an hour so I can have the remaining 2 hours to screen. So as
Oh, it's the presentation. So will this presentation again?
it's a little more in depth and detailed
Right.
now, right? Um, yeah, so it's this is like just the bones of it. So just think of another half an hour of me going a little bit more in depth of it and a lot more tools that they're going to leave it. So I'm doing checklists. So when you have a checklist in your hand of making sure how your room is supposed to look or be, so it's a lot more interactive. And then I leaving at least 2 hours so I can screen. So we're asking people to register early for the screening. So if you want, so like, so say your husband wants to be there, he can be the first person I screen, and he can leave if he needs to leave early in the day, right?
Right.
But we do have the space for the whole day. Depending on the response, we may have to break it into two separate screenings because the room can only hold about 25 people comfortably. And I say comfortably because I'm anticipating wheelchairs. So I want to make sure that I leave enough space. If somebody comes in there with a wheelchair, we can park the wheelchair and navigate the room. So, yeah.
Okay. Sounds good. He tends to have morning errands and he doesn't wrap those up until about 11:30 or 12. So I would want him to get the presentation part.
Uh-huh.
I would just ask him to make an exception and move some things around. So,
Yep. It's free and
okay.
it's for his health. So I would say,
Right.
yeah.
Okay. Thank you.
My
And thank you for
pleasure.
having this. This is really informative.
Thank you. I'm glad you enjoyed it. All right, ladies. I see Miss Jackie stepped away. I don't know if she's close by, but we're going to wrap this up. You have my contact information. Feel free to reach out to me. I'd love to get your email addresses as well. I think if you registered, I have your email address anyway. And this is going to be one of many more wellness talks. I am doing a lot more talks now on menopause. I'm doing a lot more talks on injury prevention, regardless of what it looks like, and a lot more integrative wellness talks. So, looking at other ways that we can manage chronic diseases and live healthier, more well lives. So, with that, ladies, thank you so much for your time and attention tonight. We are going to stop sharing. And oh, I see we had another person enter the room. Miss Olanda, any questions before I leave? I'm sorry. I want to make sure I acknowledge